Hi everyone. In today's video, I'll be talking about antimicrobial resistance, which is considered as one of the biggest global threats since it is directly responsible for millions of deaths every year in the world. But the sad thing is that most people are even not aware about the importance of preventing this antimicrobial resistance. So before learning what is antimicrobial resistance, we should be knowing what are antimicrobial agents. So these antimicrobial agents are nothing but the drugs or medicines which we are consuming when suggested by physicians when we are having any type of infections. So for example, if we are having bacterial infection, we are consuming antibiotics. If we are having viral infections, we are consuming antiviral agents. If we are having fungal infections, we have to consume antifungal agents. Similarly, if we are having parasitic infections, we have to consume antiparasitic agents. So like that, when we are having any microorganism infection, we are consuming the antimicrobial agent so that this antimicrobial agent remove or kill the microorganism that is causing the infection and resulting in treating of the infection. So these antimicrobial agents are the saviors, right? But what happens when these microorganisms acquire resistance against these antimicrobial agents? So when the microorganisms change or mutate themselves over time and get to a point where they are no longer respond to drugs which are previously used to treat them, this results in development of antimicrobial resistance. So when the microorganisms develop resistance against these antimicrobial agents, it will become a major crisis in the future, right? And the deadly infections will not be treated. Like simple skin infection can result in amputation. Normal procedures like cesarean, chemotherapy, surgeries, organ transplantation will be very risky because there are chances of development of infections and there will not be any drugs to treat these infections. And also it is predicted that there could be return of pre-antibiotic era where the people could suffer and die from untreatable infections. So it is very much important that antimicrobial resistance has to be controlled, otherwise it will be very difficult to cure infections caused by the microorganisms. So what causes this antimicrobial resistance development in the microorganisms? Actually, this antimicrobial resistance is a natural process which develops over a period of years, but we, the human beings, are accelerating these procedures by various methods or various practices, which involves overprescription of antibiotics, patients not finishing their treatment, overuse of antibiotics in livestock and fish farming, poor infection control in hospitals and clinics, lack of hygiene and poor sanitation, lack of new antibiotics being developed. These are some of the causes of development of antimicrobial resistance. So first one is overprescription of the antibiotics. So whenever we go to the physicians for any kind of illness, maybe commonly for fever, right, the doctors will be prescribing the medicines. Along with that, they will prescribe one antibiotic. So we have to think whether the antibiotic is really required. Only for the bacterial infections we have to consume antibiotics, but without knowing the proper causative agent of the infection, we cannot directly consume antibiotic. It may be a viral fever. So this can increase the development of or risk of development of antimicrobial resistance in the microorganisms. And second one is overuse of antibiotics in livestock and fish farming. So it is reported that about 66% of antibiotics are used for animals, not to treat their infection, but to stimulate their growth, which leads to development of antimicrobial resistance in their body as well as their surroundings like soil, water, which we all consume or which we all come in contact with, right? And next one is patients not finishing the treatment. So we have to consume the complete the whole course of antibiotics. We should not stop it since we feel better or something. We have to complete the full course of antibiotics. And the next one is poor infection control in hospital clinics, which is very common reason for the spread of antimicrobial resistance in healthcare setup. And next one is lack of hygiene and poor sanitation, like improper wastage disposal, not properly washing the hands, which results in entry of the resistant bacteria to the surrounding environments, which can easily spread to others. And the last one is lack of new antibiotics being developed. So last class of antibiotics developed and approved was very long back. Since many years there are no new antibiotics approved, but whereas on the other hand, antimicrobial resistance is continuously killing the people, right? So development of new antibiotic is decreasing, but the development of antimicrobial resistance is increasing. So this is about the antimicrobial resistance and causes of development of antimicrobial resistance. About the causative microorganisms and preventive measures we will study about next class. Thank you.